Hello everybody, welcome to the following episode. This episode I'm going to be going over orthodontics, or for simplicity's sake, the straightening of teeth. So what is orthodontics? Orthodontics is anything that has to do with the movement of teeth to fix your jawbone. And also if you have TMJ, it works really well with that. So in a, not exact, but in an essence, that's exactly what orthodontics is. That's what most people understand it to be. It has to do with anything that involves straightening your teeth, though there are other things that it does handle as well, in addition to straightening your teeth. Most people know it for that. So there's different type of aligners that have to do with straightening your teeth. You have the conventional braces that are metal attachments that go on your teeth. I used to have them actually when I was in high school. And then you also have, nowadays, you have Invisalign, and then there are other treatments that you can get that mostly involve having metal braces in your teeth that just have different, there's different methods and forms of doing it. So what's the major component between both? One of the major things between aligners like Invisalign in comparing to braces, and this has to do mainly with the majority of people, so this might not apply to you, and if it doesn't apply to you, then you can definitely get braces. But the reason why, and personally me, I favor Invisalign over braces, it's and not only Invisalign, it's any in clear aligners. What is the major difference between invisible aligners and regular braces? The primary difference between one and the other, and again, this is something that might not apply to you, but it does apply to most people. So the major difference between clear aligners and regular braces is the one, you're limited to what you can eat when you're wearing braces. With clear aligners, you don't have that problem. Two, it is a lot more difficult to clean your teeth with braces on than it is with clear aligners, because with clear aligners, you just take them out and you brush your teeth and you're good to go. Three, you don't have to worry about your gums being cut with the metal if you have clear aligners, because there is no metal and those things are not impinging against your teeth, your gums, which is what causes sometimes your gums to be cut and stuff like that, which is very common. So those three things are the primary differences between braces and clear aligners. Now, in terms of which one is faster, it's really dependent on the individual, but based on new technology, to say the truth, prior to, so I would say maybe 10, 15 years ago, braces were faster than clear aligners. But nowadays, because clear aligners they've become a lot more aggressive with how they approach their system, with how they approach their system. It's about the same in terms of how long it takes. Now, there is a difference in terms of what clear aligners can do versus what braces can do. Braces can handle any situation, obviously within the parameter of what's fixable, because there are certain situations where braces, both metal ones, conventional ones, there are situations where both braces and Invisalign just cannot handle it, and the person might have to go for surgery. But outside of those extreme conditions, braces can handle pretty much any situation, and clear aligners can't. So while clear aligners nowadays can handle type case 1 or case 2, which is just relevant to how long a case is, and also the positioning in which the teeth are, both in the front and in the back. An orthodontist determines how a person's mouth is between class 1, 2, and 3. So when it comes to those situations, they can determine, does the person qualify for clear aligners, or the person can only get braces. So in those situations, they'll make the determination. There are people that want to get clear aligners, but unfortunately they might not even qualify for it. So my opinion is, whichever one you want to get, go see your dentist and ask them, or go see an orthodontist specialist and ask them what they would recommend to you, and explain to you why they give that opinion, because everybody's different. Every dentist and every specialist has a different opinion on to why they believe one is better than the other. Me personally, I look at it more on a health issue and also the longevity of the mouth. Now, what is the main purpose of getting your teeth aligned? Obviously, everybody wants it for aesthetic reasons. It looks better to have your teeth aligned as opposed to having your teeth crooked. But there is a more bigger benefit to having your teeth aligned as opposed to having them crooked. One, you can clean them well. When your teeth are aligned, your toothbrush, your mouthwash, your floss, all work the way they're supposed to, because toothbrushes were designed for people that have straight teeth. Floss is designed for people that have straight teeth, and mouthwash is designed for anybody. But if you can't clean well, mouthwash is not going to get rid of those areas that you couldn't reach. It's only good for cleaning up any residual and any deeper areas that are looser. But outside of that, it pretty much doesn't help in any way. So when you have crooked teeth, your toothbrush cannot clean well. Your floss, you might not be able to reach into certain areas because your teeth are just way too crowded inside. And then that leads primarily to somebody getting periodontal disease in the long run, which then at that point they're going to have bone loss in the areas where normally the teeth are crooked, and then in other areas successively because they have periodontal disease, and periodontal disease moves around your entire mouth, and then they end up losing all their teeth, and it's specifically because they had their teeth crooked and they couldn't clean properly, which led to periodontal disease. So aligners and braces help in that aspect for the longevity of your teeth and your oral health. So it is extremely crucial that you get your teeth aligned. Even if you don't get periodontal disease, it is also beneficial to prevent cavities, because just like how you have a hard time cleaning those areas, they're also prone to getting cavities. So getting your teeth aligned is not only an aesthetic benefit, but it's also a health benefit. And the health benefit for me, as a person who teaches, patients, who educates them, for me, it is more important for the longevity of a person's mouth than it is to it look beautiful. Now, yes, looking teeth are beautiful, and I'm not going to deny that. And obviously, everybody wants that, and we're always here to give that to you. But the way a medical professional looks at it is, what are the health benefits? And then based on those health benefits, they give their opinion to the patient. Obviously, the patient at the end of the day has a say on what it is that they want to do. But I'm never going to tell a patient, get your teeth aligned for your beauty, as opposed to you need to get your teeth aligned, because if you don't, then you're going to run the danger of losing your teeth. And if you run the danger of getting periodontal disease, then you can honestly pay me $1 billion to make you have diamond-plated teeth. But if you have periodontal disease, I don't care how much money you give me, at the end of the day, you're going to lose all your teeth, and you're going to lose that money, and I'm not going to be happy, and you sure as hell are not going to be happy, because that's a lot of money, and it's all gone down the drain. So if you're a person who has, teeth that are crowded or crooked in any sort of way, then you want to take care of that, because you want to prevent these things from happening. And in the long run, you're going to save a lot of money and frustration. Now, one of the misconceptions that I've heard with patients, for some reason whatsoever, I'm not really sure, is that some people believe that you can't get your teeth aligned when you get older. This is far from the truth. You can get your teeth aligned at any age. There really are a few limitations. One of the limitations that I can think of that come to mind right now is that if you have periodontal disease or a history of periodontal disease, and you want to come in and get your teeth aligned, then the first thing that the doctor has to do at that point is he has to do an examination, and we have to see how much bone loss you have, which will be determined on the level of periodontal disease you have if you haven't taken care of it. If you have taken care of it, then that's a good thing. And then just the same, the doctor will check the bone loss in your underneath your gums, and then at that point we will determine if you would qualify for aligning your teeth or not. Now, the reason why we have to check that is because when and a lot of people I don't know, it's kind of funny that people don't think of this, but you can imagine you have a piece of metal, like a plate of metal that's stuck inside cement on the floor. So in essence, your teeth is the exact same way. That your tooth is inside your jawbone, in your jaw. And what aligners do is that they force the tooth to move. Either it could be to the side, back, to the back, forward, whichever way. And it's the same. It's equivalent to you grabbing that metal bar and moving it against the cement. You're putting a lot of force on the metal bar to move the cement, to move through the cement. And what happens is that when you do that, your jawbone, just like the cement on the floor, it's not going to close up and cover that area where the bar was, just like where your tooth was, with a certain exception, obviously. And I'll go over that in a second as to why it's more important to have your retainers once your treatment is done. But when you move the bar in a direction, the hole where the bar was is still there. It's just, essentially the hole's just becoming bigger because you're forcing the bar to move against the cement. So what do you do in that area? Because obviously once you're done, then the bar can just move left and right, depending on where you wanted to move it. Your teeth, while they can't move freely like that, is essentially the same thing. Now you have a hole, a space, where the tooth was in comparison to the new location. So what do you do in a case with a bar? You fill it up with cement. What does your body do in that situation? Your body, what it does is that it eventually starts closing that area and leaving the tooth in the new location where it was. This is why it's super important to have your retainers, because while your teeth are shifting and moving, that's why you normally feel pain in the beginning, is because that's what's happening. The only difference is that we're moving it at a millimeter at a time. It's very minuscule movements, little by little by little. And, you know, most people have the experience of when they first get their braces, if they get them adjusted or if they get new aligners, normally the first day or two, they feel pain and soreness. And the reason why is because of that, is because your teeth are being forced to move into a new location, and they're doing it little by little by little by little until it gets to the place where it has to get to, which is primarily why it takes a longer time to get aligners, anywhere between 6 months, even 2 years, depending on the case. Everybody's different. But for the most part, especially in our practice, I would say it's normally it's like less than a year. I mean, on average, from what I've seen, it's about 10 months nowadays. But I have had patients that have had to get only for 4 months, 6 months. But regardless of it, doesn't matter what level you're in, you're always going to feel that pain because the teeth have to shift. Now, when you get the retainer is it's just how it's called, a retainer. It retains, it keeps the tooth in place and prevents it from moving back. And the reason why you have to keep it on for such a long time, 6 months, which is not really a long time, but I understand how for some people that might be a lot. You have to keep it on for 6 months, and then after that, you pretty much keep it on only during nighttime when you go to sleep, just to make sure that if any teeth shift or move and stuff, they go back to the place they were when you finished your treatment. It's for that reason, because the retainer holds the tooth in place. It prevents the tooth from shifting back into that space where it was before, because it will move back. Now, it's not going to exactly, all your teeth are not exactly going to shift back to when you first started the treatment, but they will shift in different locations, and they might shift a little bit, but it's primarily in the direction for where they were originally. And if you don't use the retainer, then what's going to happen is that your teeth are going to shift back to not where they were exactly, but I would say maybe like 20 to 30% from the original location, and you're gonna have to get new braces or new aligners, and that's extra money. So to prevent that, you wear your retainers, and you take care of your retainers even more than you took care of your braces or your aligners, because that's really what's going to help your teeth stay in place and prevent you from having to spend money in the future to maybe have to get them aligned again, not only for you, but also if you have children, who, you know, some state programs, like for example here in New Jersey, where they will, for the majority of the time, cover a child that's under the age of 18. They'll cover their braces at 100%, or even a small percentage where the person has to pay a minimal amount of money. You know, the kids get the braces and stuff, they don't put on the retainers, and then their teeth start to shift back, and then they get older, and while their teeth are not how it was when they first started the treatment, it's still crooked, and that's still not good. So that's the importance of the retainer. And also, going back to my original discussion, you know, why a person might not qualify even, you know, after they're older, and if they have periodontal disease, to get aligners, and it's because if they have enough bone loss and the tooth starts shifting, if the bone is not enough to hold the tooth when it's shifting, then the tooth can literally just fall off a person's mouth. So if a person has periodontal disease, that would be a reason for why they might not qualify to get aligners. And if that's the case, then there are other options, you know, later on in the future. You know, as a tooth gets weaker, we could extract it, and you can get a bridge, you can get a partial, an implant, any of the things that I had discussed in prior videos. And this is only in the situation where a person has crowding teeth, or teeth that are shifted, or even spaced out teeth. Okay, so that's pretty much it for today. If you have any questions, please feel free to comment below. Leave your questions. You could also feel free to always call the office. Numbers are listed in the intro, or send us an email, and I'll always be happy to answer your questions. But as always, flourish and prosper, and I'll see you guys in the next episode.